address from Ms. Jane Kisa from Aga Khan, who is the CEO of Aga Khan. Kisumu Europe, that is K.E. Kisumu Europe. Karibu sana, Ms. Jane. Let us give us a clap as she comes. Welcome, karibu Jane.
For the distinguished guests in the room, my colleagues, ladies and gentlemen, and all protocols observed, good evening again. So I consider it a very great honor that and I'm truly humbled to deliver the keynote address to this important gathering. But it's more humbling for me to be honored to address a gathering like this, where I truly know that I have people in the room that I call my mentors, that I call my seniors, that I call my leaders in other forums. I'm actually excited. I didn't know that I'd be able to meet my chairman in this place, Mr. Collins. I'm humbled. Thank you. I like introducing myself, and I'm glad that I wasn't introduced as I wanted. And it's because I like introducing myself the way I like introducing myself. I like introducing myself anywhere that I go, that I am Jane Wanyama. I'm a Kenya registered trained nurse from the famous mother of all Kenya Medical Training College, Nairobi, where I did my general nursing. And in that college, after I was done, I went to Busia District Hospital. Fast forward, I joined Pumwani School of Midwifery, where I came through as a distinction midwife. And I feel nice about it. The reason why I feel nice about it is because I am what I am today, with whatever titles I may hold, because of the backbone of having been a nurse. And I don't take it for granted. So before I declare any other title on myself, I always want to tell anybody that I am a nurse. And I think it's important that for us as nurses, that we are the ones that should be able to stand out for the profession that we have. When we do it that way, like one said, we do not want people, and especially in this era and this time, that many people are asking, I would like my daughter to go and do nursing, or I'd like my son to go and do nursing, for only one reason. Why? Because after they are done with nursing, they'll go to UK or go to US. That's not why we did nursing. Because we did nursing because we wanted to do nursing. Because it was a profession that we wanted to be associated with. So that's Jane. And by God's grace, and I always say it's by God's grace, that today I work at the Aga Khan Hospital, Kisumu, as the CEO of the hospital. It's Kisumu, Aga Khan Kisumu cluster, as they call it. I thank God for my leadership at Aga Khan Health Services, that they saw the potential in myself, and they thought that I would be able to do it. And it's been by grace, 5 years going, and much more to happen. I'm actually feel very privileged that a hospital that came up as a maternity nursing home without any master planning and everything. I don't know how many of you were last in Kisumu. We are coming up with a mega building today, a beautiful hospital. It's going to be a beacon in the Western region. Something I'm very proud about, and I thank God for. When I was asked to speak, I had 1,001 things put on my table. And I asked myself, what am I going to speak to these professional, learned nurses? And I remembered, and something that I actually even had to ask Omia when he was here earlier, remind me, what is ECSACON again? And I want to thank you, Omia, that you're saying it's time to start moving. Because there's one challenge that we always face in life, is we conceive, but we don't give birth and make the baby move on. I'm sure the COSEXAs of this world that are partnering with in Aga Khan, for example, the anesthetists have started one that I know I'm partnering with at Aga Khan Hospital in Kisumu, and within the Aga Khan, came way after ECSACON. So really it is time that ECSACON moved and provided the opportunity to the nurses not just to present papers, but to be able to train in those special programs, enhance their skills, and get the fellowships in them, and come and impart on healthcare of the communities that we are in. I had to say that even before I get to what I wanted to say, because I know I wasn't going to touch on that. So I was asked to speak about health system strengthening and the role of a nurse. A good health system delivers quality services to all people when and where they need it. The exact configuration of services varies from a country to another. But in all cases, it requires to have a very robust finance mechanism, a well-trained and adequately paid workforce. And I would want to put well-trained, because ECSACON, your role is in that, well-trained. So that is bold and underlined. That backs it with very reliable information. Someone has just talked about us having a lot of information. If you look back in the healthcare industry, if there are people that have information and in loads, is none other than nurses. But what do we do with that knowledge? What do we do with that information? Or are we at that point where we say we are data rich and knowledge poor? And not because it wants to be knowledge poor, but because we are not using it to make the changes that we want to see in the healthcare industry that you are working in. Health outcomes are unacceptably low across much of the developing world, and Kenya is also included in that. And the persistence of deep inequities in the health status is a problem from which no country in the world is exempt. At the center of this human crisis is the failure of health systems. Much of the burden of disease can be prevented and cured with non-affordable technologies. The problem usually is getting drugs, vaccines, the information that is required to make decisions or to form prevention and care on provide the treatment on time. There's a lot of issues that nurses on the ground face that really inhibit them from being able to deliver the type of care that they should. It's widely accepted that only through building and strengthening health systems will it be possible to secure better health outcomes. The key question is, what does this mean to our practice? For close to the last 2 decades, the importance of health systems as a part of the global health agenda has been a topic of interest and discussion. To achieve their desired goals, all health systems have to carry out some basic functions, regardless of how they are organized. And I'm sure we all know what these are. They need, 1, to be able to provide the services. 2, you need to be able to develop the health workers and the other key resources. So again, develop the health workers. Have to mobilize and allocate finances. And ensure health system leadership and governance. And these are some of the challenges that we face today. And the reason why our health systems are not as robust as they should be. The World Health Report 2000 defined overall health system outcomes or goals as number 1, improving health and health equity in ways that are responsive, financially fair, and make the best of the most efficient and use of available resources. WHO Health Systems Framework breaks down this into 6 pillars, which I think if we had time, I wouldn't have wanted to read them out, and I'm still not going to read them out. It's my hope that the team here actually know those 6 pillars that WHO has been able to define as important for health system strengthening. It is only through building and strengthening health systems that it will be possible to secure better health outcomes worldwide. Irrespective of how a health system is organized, there are some desired attributes for each building block that holds true across all systems. Among them, of course, is health workers. As Mrs. Elizabeth Oyuer said, one thing that we always said, and I still believe is today, that nursing is the heart of healthcare. And if nursing is not right, it doesn't matter the institution, it doesn't matter the facility. I'm sure Musimi, you know what I'm talking about. I'm sure Lydia Nyachiro, you know what I'm talking about. Nursing is the heart of healthcare. So when we see things going wrong, we should actually ask ourselves, what is our role? What is our role? So what is the role of nurses in the health strengthening, in health system strengthening for the future? One of the key indicators of a robust health system is one of attaining health equity. A word that I'm sure we've been hearing so much in the last few years. The decade ahead will test the nation's nurses in new and very complex ways. Nurses live and work at the intersection of health, education, and communities. Nurses work in a wide array of sets and practice at a range of professional levels. They are often the first and the most frequent line of contact with people of all backgrounds and experiences, seeking care, and they represent the largest of the healthcare profession. One of my nurses loves saying this word, that nurses are the ones that are there when a baby is being born and they have to wipe it with that gauze. And the nurse is again the one that will be there when they want to close those eyes. That's a nurse. And so we need to understand where we are positioned in as far as humanity is concerned. So a nation cannot fully thrive until everyone, no matter who they are, where they live, or how much money they make, can live their healthiest possible life. That's health equity. We all know that helping people live in their healthiest life is and has always been the essential role of the nurses. Nurses have a critical role to play in achieving the goal of health equity, but they need robust education. I don't know how many of us here are from, at least I had my teaching, I know there are nurses there. I don't know how many of us are from teaching institutions. How many of us? Yes. You are the ones that are shaping what it is that is expected. We are the ones that support the work environment. We need to have autonomy. And when I asked Omia, so Omia, what are you doing now? He gave me an interesting title that I don't understand. Something parliament, something, something, something. And I think if there's anything that we need, is nursing needs not autonomy on papers. Autonomy, obviously, I don't know how to put it. You know that we are autonomy, you know, or you can say it's autonomy, but it's like it's autonomy on paper. We need some autonomy where we don't have to go through other categories of people or professionals to be able to pass our point as nurses. The ultimate goal of HSS requires a strengthened nursing capacity and expertise. By leveraging these attributes, nursing will help to create and contribute comprehensively to equitable public health and healthcare systems that are designed to work for everyone. One of the main drivers of health equity is having the universal health coverage. In Kenya, the UHC was launched in February 2022. Kenyan nurses, like all worldwide, will have to play a very vital role in achieving UHC. I don't know how many were involved. I don't know. I don't know. And remember, the moment at which people are involved, from the point of conception and planning and everything, then you own it. And you can drive with it. You can understand what issues are there. What do we need to do to make sure that it becomes the success that it should be? I'm from Kisumu, and in Kisumu, it was one of the counties that we launched UHC. And 1 year after, when we sat back to look at what went wrong or what should have been done, there was the big issue of health financing. My prayer and hope is that we will not go 1 year down the road and say we should have deeply involved the nurses for UHC to succeed. From the perspective of Anne Kennedy, ICN, representing more than 20 million nurses worldwide, considers that health care is a human right for everyone, not just health care, but quality, affordable, timely, and accessible health care. The country or place where a woman lives should not dictate whether she lives or dies because she cannot afford health care or it is not accessible. Neither should a child die from malnutrition or infectious diseases because of where he or she has been born. And it's not a wonder today, if you see what is happening, and specifically for the private sector, that we are all now mushrooming. We are getting into the machinanis, right? Because we understand that that is really where we should be, trying to make healthcare accessible. Of course, with its challenges, because by the time the patient is coming to me, she will have to pay. But if she was a patient that maybe was under the UHC and fully covered, then they may not have to pay for it. But it's possible that they get there, and when they're getting there, yes, they'll find the nurse, but she doesn't have what she requires to be able to provide the care that is required. And that is why it's important that nurses then are involved. Today, we cannot run away from primary health care. Neither can we run away from the fact that we should have a continuum of care that starts from primary health care to secondary health care to tertiary health care. And in all these places, we need nurses to be there. We need nurses with the knowledge that it takes, with the skills that it takes. But also, most important, with the attitude that it takes. So that we can be able to create proper demand and supply for the services that we are offering. And so then, my big question for us who are sitting in this room is, who is better placed to inform health policy, be it in an institution level or at national level? Than us. The structures that we have in whichever facilities that are there should be able to provide opportunities for nurses to be at the policy development table, so that when the policies are being made, nurses are contributing to them. Globally, we know that we are over about 10 million nurses in the world, and this only means that we are a force to reckon with if we want the world that we want to see and the change that we want to see, and more so equity, because that's our core business. Without nurses, without investing in nurses and improving the conditions of their employment, governments will not retain nurses in the health workforce and therefore never achieve UHC. It's just a fact. When COVID came, there was lockdown of everywhere. Then COVID came down, then skies were opened. If you want to know how many nurses have left for the US, come and ask me. I have like about 50% of my nurses that have left the country for the US. What are we doing? So we've become a training ground for the first world, as they call themselves. So it's important that there's someone that looks out for this nurse. We'll take them for the training. And even when you take them for the training, they'll be ready to buy out the training. I don't know if you understand what I mean by that. So she'll go for nephrology nursing. It is about 250,000. She'll pay you the 250 and take the next flight to US. What are we doing? So we've become a training ground, and a training ground of basic nursing. And the few that are becoming ICU nurses, nephrology nurses, all those specialty nurses are just going. So really something needs to be done if we are going to retain and have what it takes in this country. So again, talking HSS, COVID pandemic in many ways taught us and sent a message home of the vulnerability of our health systems, not only in the world, but also Kenya inclusive. If I'm not wrong, at one point there was even a call of, did you ever work as a nurse? Please just come. Those 87 ones that they were talking about, weren't they called to come and work? And we are speaking UHC. I think we need to sit back and ask ourselves, what do we need to do? It also brought to the limelight the interdependency between the public and the private sector in strengthening health systems. And so when you talk about collaboration, when you talk about integration, when you talk about partnership, when you talk about teamwork, nothing taught us better than COVID pandemic. And so we need to think and ask, what should we do? What policies should we have in place today that can help us only be better if anything like that was to happen again? It is therefore true and goes without saying that WHO vision on health system strengthening cannot be delivered without nurses. It can't. Ladies and gentlemen, allow me to conclude by saying that the need to move towards building a resilient health system together is inevitable. And I take this opportunity to assure you that if we believe in ourselves, we are able to get ourselves in that place where we can influence healthcare systems, not only nationwide, but also worldwide. If we believe in ourselves. And if we believe in ourselves, I actually want to challenge us as nurses that one thing that is happening today is that we need to embrace things as they are happening. People are speaking stories about themselves. Nurses, we need to go out there and speak stories about ourselves, other than bringing each other down. We need to speak stories about ourselves. The good things that we are doing down there, the good things that that nurse in Sabatia is doing, those nurses that are serving those PPHs, those stories need to go public. I actually don't know when I last saw JK live interviewing a nurse. I don't know. When did you see? We need to get out and speak stories about nurses and what nurses do and what nurses are capable of and what's in nursing that makes the difference. And more so at times like now when we are thinking UHC. Finally, I again want to thank the organizers of this conference for this opportunity. And on behalf of the Aga Khan Health Services East Africa, I want to assure you of our commitment to being part of the very strong health system through integration, collaboration, and with all other stakeholders, just to see that we can impart and make a difference. And most important, stand up for the nurse. Ladies and gentlemen, nurses, you must be intentional. I want to challenge us, that I'm glad that we're having those papers, but I'm saying we need to be intentional. We need to be intentional about what we want. We need to be very intentional about the future that we want. The future that we want to see about nursing. We are talking about Eswantini. I introduced myself as a nurse midwife. I'll tell you where, for those that have worked with me, will tell you that Jane is a passionate midwife. But even when I am branded the CEO, I sit down on the table and will still talk midwifery. And when I hear that mother crying in the labor ward, I'll run to that labor ward. Do you know where I got it from? South Africa. And these nurses once attended a meeting, their conference there, and the midwives were so passionate, and they were singing, "Until I reach my goal." And I always remember getting back, then I was in Aga Khan, Nairobi. And my chief nurse then is when they just introduced the BSN nursing. And when they introduced the BSN nursing, it was like all nurse leaders or team leaders were supposed to do the BSN. And I remember facing my chief nurse, and trust me, it's the same thing I'll tell her even here today, and she knows it. I told her I wouldn't do BSN. I wouldn't do BSN because I don't want to do BSN. I want to do midwifery. Being sure of what you want and going for it. And when I sat in that class of midwifery, and I sat and finished with UNISA, University of South Africa. Today, they imparted in me such that I'll see a pregnant woman anywhere, even in the supermarket, and I'll actually talk to her. Not because I want her to come to Aga Khan to deliver in Aga Khan, but just to make sure that she's attending clinic and that she will be ending up deliver somewhere. That's the midwife in Jane. That's the midwife in me. So I'm saying we need to be very intentional. We need to be very passionate about what we are doing as nurses. And if we are not, then who will be for us? Who will go with it for us if we don't do it ourselves? So let's be deliberate and position ourselves, nurses, as the people that are called to spearhead health equity agenda in the world and in Kenya. God bless you.
Ladies and gentlemen, we want to award our very own senior nurses with a certificate of recognition day of June 2022. So we start with Benson Mangera. Let's clap for Benson. Benson, followed by Isabella Mbai. Followed by Rose Samutani. Oh, sorry. Rose to be followed by Grace Omulogoli. Yes. There you are. Yes, that class. Then we have Henrietta Hamati. After Henrietta, we have Truti. Truti Munyendo. Isabella Waweru. Japheth Mugo. Then we go to Rosemary Mutua. Polepole daktari achukue foto. Daktari bado. Followed by Lydia Pendo. Then we have Winnie Alonda. Winnie Alonda. Yes. Yes, now you will be giving Jane Wanyama. Now, Fred Obiya will be giving Jane Wanyama. Then Jane Wanyama will be giving Fred Obiya.
the last in that class, you can guess, isn't it?